Good evening, dear viewers. Welcome to the online pregnancy school. My name is Dr. Linda Vanotu, and I welcome you to this program, which is proudly sponsored by the Promise Foundation and Reverse Tap. Over the past few weeks, we have looked at menstruation, infertility in the man and also in the woman. Today we're going to move on with our discussion on pregnancy. Remember that this program is about pregnancy, delivery, and childcare. And today I'm happy to introduce my guest. We're going to talk about the first 3 months of pregnancy. And with me to do this is my sister, a colleague, Dr. Ama Gani. Dr. Ama Gani works at the Greater Accra Regional Hospital, or RAGE Hospital as a lot of you know it. She's an obstetrician gynecologist. Big word. I'm sure she will explain to us what it means. Doc, you are most welcome.
Thank you very much, Doctor.
Can you please explain to us what is obstetrician gynecologist? Who is he or she?
Okay. So an obstetrician is a doctor who takes care of pregnant women. So all issues that have to do with pregnancy. And a gynecologist is the doctor who takes care of other general women's issues. So from fibroids to infertility. Yes, that's a gynecologist.
So this is 2 in 1. So if you have issues to do with the woman who is not yet pregnant, but she wants to become pregnant, she has other issues to do with her ovaries, her womb, and other things, then that is the gynecologist.
Exactly.
But if you are pregnant, then it's an obstetrician.
Yes.
So we have 2 in 1.
Yes, please.
Welcome.
Thank you very much.
Today we are going to discuss pregnancy. And how does it happen? How does pregnancy happen?
So pregnancy happens when, in layman's language, a woman's egg meets a man's sperm. So that has to happen by all means for a woman to get pregnant. And it only happens when a woman is ovulating. A typical woman will ovulate once in a month. So if you have using a typical woman, for example, she has a 28-day cycle. So she will probably ovulate around day 14. So this is when she's releasing her egg. Around this time, from 5 days before that day 14 to 1 day after the day 14, a woman can get pregnant when she has unprotected sexual intercourse. So when her egg meets a man's sperm during this window, then she can get pregnant. So when the sperm fertilizes the egg, then a woman can get pregnant, or we say a woman gets pregnant.
Okay, Doc, we know that during sexual intercourse, the sperm enters the woman from down. Is that where the fertilization takes place?
No. So the sperm actually swims. The sperm will swim up the vagina through the cervix, which is the neck of the womb, through the uterus, and up to the fallopian tubes, or the woman's tubes. Fertilization occurs in a part of the woman's tube known as the ampulla. That's one of the largest parts of the woman's tube. So this is where the sperm will meet the egg, in the woman's fallopian tube. So that is where fertilization takes place.
Okay.
Yes.
And when it takes place, then what happens? It means that is where the sperm will swim to go and meet the egg that has been released.
Yes.
Then what happens?
Then the fertilized egg, or what we call a zygote now, because the egg and the sperm have fused. So they form a new entity known as a zygote. This will start multiplying rapidly every day. And then this zygote would move through the fallopian tube into the uterus, or the uterine cavity, where it would implant. By this time, it's no longer just 2 cells, one from the man, one from the woman, but it has multiplied several times. And then this group of cells implants into the uterine cavity. So implantation actually occurs in the uterine cavity. Fertilization will occur in the tube, but it cannot stay there. If it stays there, it's a bad pregnancy. It's what we call an ectopic pregnancy. So in women who have problems like partially blocked tubes that are abnormally long or abnormally short, there's a problem with this movement of the fertilized egg through the tube. So then it gets stuck in the tube, and then you have an ectopic pregnancy. But for a good pregnancy, this fertilized egg should travel through the tube into the uterine cavity to get implanted there.
Okay. Ladies and gentlemen, from our previous discussions, we learned that it is important that this tube remains open. Because from what we have just heard, if the sperm doesn't have the way to move through the tube, it will not meet the egg. Doc.
Exactly.
And if it meets the egg and the tube is partially blocked, it will stay there.
Oh, yes.
And as it tries to grow, then it will burst.
Exactly.
And that is what the ectopic that we talk about is all about. Okay. But how big is this when the sperm meets the egg? How big is it? Can we see it with our eyes?
At this stage, it's microscopic. By 9 weeks of pregnancy, when we start calling the embryo a fetus, because they started developing into a human being, you start seeing parts that look like a human being. Then it's the size of a kidney bean. Around 9 weeks.
Yeah.
Yes, around
Okay.
yes, that's the size of a kidney bean. But immediately there's fertilization. The zygote you cannot see with your naked eye. It's microscopic. Yes.
Wow. Microscopic means that you cannot see it with your eyes. And that is the wonder of nature. God's work. That this thing is so small. And look at us sitting here. That is how we all started.
Exactly.
Doc, so what is the first trimester and what happens?
So when we refer to the first trimester, we are referring to the first 3 months of pregnancy, or the first 13 weeks of pregnancy.
13 weeks.
13. Because
Okay.
you know that a calendar month is more than just 4 weeks. You have 4 weeks is 28 days. So unless it's February, the other months have maybe 30 days or 31 days. So when you add it up, 3 months will give you about 13 weeks. And that is the first trimester.
Okay.
So the first trimester of pregnancy refers to the first 13 weeks or the first 3 months of a woman's pregnancy. What happens is, first of all, like we said, there's fertilization, then there's implantation in the uterine cavity, and then the embryo starts to grow. During this period, this is the period we call embryogenesis. This is when all the organs, or most of the organs in the fetus forms. So from 6 weeks up to 13 weeks, a lot of things happen. By the end of 6 weeks, you have what we call the neural tube forming. The neural tube is what develops into the brain and then the spinal cord.
Wow.
Yes, it's developed very fast by 6 weeks of pregnancy.
Ladies and dogs, before you continue, it is very important that we understand how this baby grows. Because this is the time that a lot of people may not even know that they are pregnant.
Exactly.
And therefore they do all kinds of things. So as we go along, is there anything that can disrupt this development?
Yes, so this period of embryogenesis, or this period where the organogenesis, where all the organs are forming, is very, very sensitive. If you take any drugs you're not supposed to take, or if you are exposed to toxins you're not supposed to be exposed to, it could cause a malfunction in the organogenesis process. So instead of organs forming a certain way, they get malformed. So you could either have a spontaneous miscarriage in the first trimester, or if the pregnancy develops to term, to 9 months, you could have a baby that is born deformed. So it's very important that in especially the first 3 months of pregnancy, you keep away from drugs that a doctor does not prescribe. You keep away from herbal medications. You keep away from environmental toxins that can disrupt the process of organ formation.
Okay, thank you very much. So you were in the process of describing to us how this baby grew. So by 6 weeks.
6 weeks, the neural tube forms, which develops into the brain and the spinal cord. The heart also forms.
As early as 6 weeks,
early as 6
the
weeks.
heart has formed.
Yes, the heart is forming.
Yeah.
So by the end of 8 weeks, you have other structures forming, like the eyes, the nose, the mouth, the ears. They all form very fast. You have the limbs forming, the arms, and then the legs also forming as well, as early as 8 weeks. And then by 12 weeks, 13 weeks, when the first trimester is ending, you have very fine features forming, like fingernails, toenails. You have the external genitalia forming as well. So by the end of 13 weeks, most of the structures that would identify the features as a human being have been formed, and then they are working properly.
Wow. That is interesting.
Yes.
By the end of the 13 weeks,
Yes.
you can appreciate that this is a human being.
Yes.
The heart is beating.
Yes.
The
Definitely.
fingernails are there.
Yes.
Wow. And you know whether it's a boy or a girl.
If you
Or-
have a very high resolution ultrasound, yes.
Some people want to know from the beginning.
Yes, but 13 weeks is a bit too
It's too early.
Yes.
But at least a human
A
being.
human being.
Okay, doc. So what should the woman do? What should she know about this, the first 3 months of pregnancy? What should she know?
The first thing she needs to know is as soon as she misses her period, she needs to report to a hospital. It's common amongst Ghanaian women to wait till they are about 3-4 months pregnant before they report to the hospital. I think they want to see if the pregnancy will stay before they report, but this is very dangerous. One, because we already mentioned ectopic pregnancies. You could miss your period, you could be pregnant, but the pregnancy will not be in your womb. It could be in your tube. Now, if we don't pick this up early and then the pregnancy grows, it will burst the tube and you're going to bleed into your abdomen. This is a life-threatening emergency.
Yeah.
You could pass away if you don't report to a hospital early enough to have surgery done. So that's why it's important for a woman to report as soon as she misses a period. We'll do a scan to find out whether the pregnancy is in the womb where it's supposed to be or is outside the womb in the tube or in the abdomen. Apart from this, the most sensitive ultrasound scan for dating a pregnancy is the first trimester scan. So if we want to be able to accurately tell how many weeks or how many months pregnant you are, it's important that we have at least one scan in your first trimester. Also, we need to know how many fetuses are growing in you. So are they twins, are they triplets? It's easier to pick this up in the first trimester as compared to the, for example, the third trimester. So these are some of the reasons why it's important that you report to the hospital as soon as you miss your period. Apart from this, you need to talk to a doctor. So there are some women who have comorbidities or other illnesses they are carrying, for example, hypertension, diabetes, asthma, epilepsy, sickle cell, HIV, hepatitis. Any of these can affect a pregnancy. So it's important that you see a doctor early to find out how well controlled these conditions are, if there's any of them that could affect the pregnancy adversely, so that we can start controlling early. And then a lot of Ghanaian women don't practice preconception care. They don't see a doctor before they get pregnant.
Yeah.
So most of them are not on folic acid before they get pregnant. But once they report to the hospital early, we'll put them on folic acid as required.
And doc, somebody might miss the period and will not know that she's pregnant. So what are some of the signs or something
Okay.
that they will let somebody go to the hospital that I believe I'm pregnant? Because some people would go to the hospital, they say, I never knew I was pregnant. By
Yes.
the time I got there, they said I was 7 months pregnant. What happens?
So this is quite common in women who have never given birth before. It's also common in women who have irregular periods. So in their usual lives, they don't see their periods for 5 months. So when they get pregnant and they haven't seen their periods for 5 months, they think it's normal. So it's common in these group of women. Other signs apart from the missed period they should be looking out for is, excuse me, the breast tenderness. So women have tenderness.
That's why you touch the
Yes,
breast.
touch is very
Painful.
sensitive. Yes, the breasts are very sensitive in the first trimester. Some women also have an implantation bleed. That's when the embryo is implanting in the uterus or is burying itself into the uterine cavity. They see a little blood. A few women see some blood. It's not as heavy as their regular periods, but it comes around the time they are expecting their period. So that's
Yeah.
another sign. Some women complain of
Okay, so that is where some women say that I've been having my periods.
yes.
But when I went to the hospital, they said I was 4
pregnant.
months
Yes.
pregnant.
Yes.
Because of that.
Implantation.
Yeah,
bleed.
okay.
Yes. So then there's also tiredness or fatigue. Some women complain of feeling tiredness all the time. Some women will complain of heartburn. Some will complain of constipation. Some may have some mild cramping lower abdominal pain. Some may have headaches. Some may have nausea. About 85% will have nausea and
That is,
or
they feel like
They feel like vomiting or they will vomit. What we commonly call morning sickness.
Yeah.
Yes. So these are some of the common signs that they should be looking out for.
Okay. So if you are a woman and you have even been having irregular periods, but you have Now you wake up in the morning, you feel like vomiting. You have this tiredness, you have a headache. Don't just take it as one of those things. It's important that you go to the hospital, isn't it?
It is.
Doctor, there are some complications that can happen around this time.
Yes, there are several of them. The first one is a spontaneous miscarriage. Up to about 1 in 2 women may miscarry their first trimester pregnancy. It's quite common.
It's common.
Yes, and usually this is because there may have been a chromosomal abnormality. When the egg met the sperm, the number of chromosomes in one of them may have not
what
been.
Are chromosomes?
So these are chromosomes are what contain the genes. So what makes you you, and what makes you different from another person. So an egg contains 23, a sperm will contain 23. So when you put it together, that's 46.
Yes.
So every regular human being has 46. So if in a situation where the egg has 22 or the sperm has 22, you put it together, you're not getting the 46. So this is one common reason why. So it could be a problem with the number, or as the cells are splitting, some of the cells could have an abnormal number of the chromosomes. So this is one reason why a first trimester pregnancy could miscarry.
Okay.
So that's one complication of first trimester.
So we shouldn't cry over it, right?
No, unless it is very, very frequent. You have recurrent spontaneous miscarriages in the first trimester.
Yeah.
Yes, then we'll have to investigate. But if it's just one, no, you shouldn't. It's disturbing, it's upsetting.
Disturbing, especially
Yes.
when that is your first one.
Exactly. It's
And you are
disturbing.
married, it's your first one. You are hoping that this one will go on
Yes.
to term. Okay.
But it's quite common. It's for you, it's a very big deal, but it's very common.
It's very common.
Yes. So that will usually present as bleeding. So that's a complication in the first trimester. A woman could present with bleeding. She could also present with excessive vomiting. We mentioned morning sickness, which
Yeah.
is the nausea and vomiting. But in some women, they have what we call hyperemesis gravidarum. So they are vomiting excessively, and it is not because of any organic cause. So if you're a pregnant woman in your first trimester, you cannot hold down any food. You keep throwing up anything you eat or drink. That is not normal. You need to report to the hospital.
Okay.
Also, if you have severe abdominal pain, that could be, or dizziness, especially associated with dizziness, that could be a ruptured ectopic pregnancy. An ectopic pregnancy that has burst the tube and is causing you to bleed into your abdomen.
Sometimes some people even go to the market and you find that they collapse. So they send them to the hospital only
Yes.
to be diagnosed with a burst
Yes.
ectopic, and
Yes.
they have to go to the theater because they didn't know in the first place
Yes.
that they were pregnant. Or
Yes.
when they were having those symptoms, they never bothered about it.
If they had
Okay.
reported, for such a woman, if you report early
Yeah.
in the first trimester and a scan is done, we'll be able to tell whether the pregnancy is in the womb or not before it bursts. So if you're able to pick it up before the tube bursts, there are conservative methods of managing. You may not necessarily have to go through surgery.
Okay.
Or even if you have to go through surgery, it could be a minimally invasive or a keyhole surgery. So it's very dangerous when we allow the tube to burst first.
Right.
In this case, you may actually even require blood transfusion. So yes, it's important to report early.
Okay, so Doc, we are talking about the complications. What
Yes.
are other complications that women should be aware of?
Some women also gain weight excessively in the first trimester. Some women lose weight in the first trimester. Both are abnormal. In the first trimester, you should be gaining about 1 to 3 kilograms in total in the first 13 weeks. So if you are gaining more than this, or if you are losing weight, we need to find out why.
Yeah. Okay, so now when a woman is pregnant and she comes to the hospital, what is done for her? Why should she come?
So the very first antenatal visit is what we call a booking visit. At this visit, you would be seen by either a midwife or a doctor. During this visit, a thorough history is going to be taken. So you're going to probably have a 10 to 15 minute conversation. The midwife or doctor will ask you so many questions, from your name, your age, where you live, how many children you've had, how many miscarriages you've had, if any, how many terminations of pregnancy, when your last period was. You would also want to find out if you have any chronic illnesses, or if in your family there are illnesses like hypertension, diabetes, asthma, sickle cell, whether there's a history of multiple pregnancy, for example, twins or triplets in your family, whether you've had a pap smear done before, what your menstrual cycle was like before you got pregnant.
So could you advise that every woman has the smear? And please explain a little bit about the pap smear. What is it and why should women go for it?
So the pap smear is a screening test for cervical cancer. And cervical cancer is one of the leading causes of cancer deaths in women in Ghana, actually worldwide. Cervical cancer presents late. By the time a woman realizes she has cervical cancer, by the time she starts showing symptoms of cervical cancer like abnormal vaginal bleeding or bleeding after sex or a smelly vaginal discharge, it may likely mean that the cancer has spread so far that we may not be able to cure it. No surgery may be done to cure it completely. So cervical the pap smear is a screening test to pick up what we call pre-malignant or precancerous changes in the cervix. Now these can be treated very easily. In a 15-30 minute procedure, the pre-malignant lesion can be treated, and these women, majority of them, do not go on to develop cervical cancer. So it's important that every woman has at least one pap smear every 3 to 5 years.
But is it easily available? Can somebody just go and get it done?
Yes, you walk into almost every facility in Ghana, especially the Ghana Health Services facilities. Any family planning center, you walk into any one of these and then they'll take the smear and you should get your result back within 2 to 3 weeks.
So ladies out there and men, for your sisters and for your wives and even friends, kindly encourage them, the ladies, to go and have this checked. If you go, you have the pap smear, as she said, it's just a very simple procedure. They will check the cervix, that's the tip of the womb. They will check it, see whether there's anything that is not right, and make sure that whatever needs to be done is done before it goes on to become cancer.
Exactly.
Which now becomes very difficult to handle. Yes, Doc.
Okay. So back to the history.
Yes.
Your midwife or your doctor is still taking your history, trying to find out whether you drink alcohol, you smoke cigarettes, your religion, where you live, wants to find out what drugs you've been taking during the pregnancy and before, whether you take herbal drugs, whether you have any allergies to any drugs or food, whether you object to blood transfusion. After your history is taken, he or she will go on to examine you, a thorough examination from head to toe. She'll be looking out for signs like pallor. That may signify that you're already anemic, which is dangerous for your pregnancy. Would also examine for jaundice, will examine your oral hygiene, will look for any anterior neck masses. That may signify you have a goiter. Also examine your breast, because a lot of women don't do the self-breast examination. They don't go to hospitals to have it checked. So that's an opportunity to have your breast examined. We examine your abdomen as well. Try to feel for your uterus to see whether it corresponds with what we think how far along we think you are. Examine your feet, check whether they are already swollen or not. After that, we also want to know your weight. We want to know your height to calculate your body mass index. This will tell us whether you're overweight, you're underweight, or you're within normal range. We want to know what your blood pressure is, what your pulse is, and what your respiratory rate is, what your temperature is. After the examination, you'll be made to do a list of investigations.
Okay.
So some of these are the full blood counts, where we are looking for your hemoglobin level to find out whether you're anemic or not. If you're anemic, we have to start treatment immediately.
Okay.
We'll also want to know your sickling status and your HB electrophoresis. This is important because if you have sickle cell, you're a high-risk pregnancy, which I'll get to later on. So we have to take particular care of you. We also want to know, even if you don't have sickle cell, but you have the sickling trait, you are AS, we need to know what your husband's genotype is. Because if he's also AS, it's possible that your
baby,
yes, be born with the SS genotype. If he's AC as well, your child could be born with an SC genotype, which is sickle cell disease. So we need to know that, and then we need to start counseling you early. We need to know what your blood group is. We need to know what your rhesus status is. This will help us throughout the pregnancy and during labor and delivery. Just in case you need blood, we already know what your blood group is. The rhesus status will also help us manage the pregnancy and manage the baby look out for what we call resource incompatibility. Yes.
So there are so many things.
So many
ladies
tests.
out there, please, if you are pregnant, don't stay at home. We are talking about the first 3 months of pregnancy, and my guest today is Dr. Amagani. She's an obstetrician gynecologist at the Ridge Hospital. From what she has told us, there's so much that you can benefit from if you go to the hospital once you realize that you have missed your period. So please don't stay at home. This is the online pregnancy school, which is sponsored proudly by the Promise Foundation and Riverstep. Doc.
Okay. So other tests that we'll do will include the HIV test. We'll check for syphilis. We'll check for hepatitis B, because these can affect the growing baby as well. We'll check your urine to make sure you don't have a urinary tract infection that can cause a miscarriage or can cause anemia or preterm labor later on in the pregnancy. We'll check your stool to make sure that you don't have a parasitic infection that could make you anemic.
That you don't have worms in your tummy.
Yes, exactly.
That will be taking a little blood at a time.
Yes.
And making you anemic. Okay.
Yes. So these are the tests we'll do. Then we do the scan as well to finally confirm that yes, you're pregnant, and then figure out where the pregnancy is located, date the pregnancy, count the number of fetuses. So we let you know whether you're carrying one or you're carrying two. After all of this, we start the interventions. So at first contact, we recommend that you get, if you haven't completed a tetanus schedule, you get your first tetanus vaccination. We'd also give you an insecticide-treated net, a long-lasting insecticide-treated net.
That you should sleep under.
Yes.
People keep it.
They say they feel too hot.
Yes, some of them keep it in the pack.
Yes.
Another pregnancy, they go for another one. Keep it.
Yeah, but please try and sleep in the net.
Yeah.
Yes. And then we'll start you on folic acid as well. So essentially, this is what we do during the first visit, or what we call the booking visit. By the end of this visit, we're able to classify whether your pregnancy is low risk or high risk. A low risk pregnancy means everything is essentially normal. You can be seen by a midwife. You don't have to be seen in a tertiary facility, maybe in a primary or secondary facility.
Yeah.
And then the schedule can be followed. Now we are using the 2016 WHO guidelines, so you're having 8 visits throughout your pregnancy. However, if we classify you as high risk, meaning that there's a long list of high risk pregnancies from multiple pregnancies. So if you have a twin pregnancy, if you have HIV or syphilis,
anything that can affect
the pregnancy, either you or the baby, you are high risk.
Yeah.
So then it means that you may have to be seen in a tertiary facility. You may have to be seen by a doctor, and then you don't follow the usual schedule. So your doctor may ask you to be coming in more regularly than those who go for the routine antenatal care.
Okay, so it means that if you go to the antenatal and you are asked to see the midwife, you should not be unhappy that I wanted to see the doctor. The midwives are also very well trained to see pregnant women. They will let you see the obstetrician gynecologist if you have to. And if anything changes along the line, they know exactly what to do. So please don't be discouraged that I wanted to see the doctor. The midwives have also been trained. And if you are asked to continue with your antenatal in a facility or the district hospital or even the polyclinic, it is good enough. If anything happens and they have to let you go to the higher level, they will definitely send you to the higher level. Doc, there are some myths. Some people have some, especially those who have tried over a long period to become pregnant. As soon as they see that they are pregnant, then they think they cannot even walk. They have to be careful when they are stepping. When they get up from the bed, they have to be careful how they walk. Are there some of these things that are true, that if I'm pregnant and I'm walking, can my baby just come out?
No, it typically doesn't work like that. We recommend that you, especially in the first trimester, you carry on with your routine lifestyle. But if you, for example, were working out very vigorously, you will be advised, contact sports, or yes, someone could hit you in the abdomen, that could cause a miscarriage. So for example, if you are doing kickboxing or karate or I don't know how many Ghanaian women do that, but yes, you will be advised to stop and then do something safer. Apart from that, you're allowed to do moderate exercise. You're allowed to do brisk walking. You're allowed to run, but you shouldn't sit or lie for long periods. That is very unhealthy because the pregnancy hormones are already, how do I put this? They can make your blood clot easily, and that is dangerous in pregnancy and dangerous for anyone. So if you are lying down for long periods or you are sitting down for long periods, you can have clots developing in your legs. If these shoot up to your lungs, then that's deadly.
Yeah.
So what we recommend is, even if you are sitting, every 2 hours you should get up and walk for at least 10 minutes. And throughout the 24 hours in a day, you should not sit or lie down for more than 6 hours. You need to stand up and walk. So no, don't lie in bed for prolonged periods unless you have been asked so specifically by your obstetrician. If not, do not lie in bed. Another myth is that you cannot travel. Yes, but it's safe. First trimester traveling,
So I can travel from Accra to Bolga.
You can travel unless the road is like very bad and then there are a lot of potholes, and yes, but apart from that, air travel, road travel, they are both fine in the first trimester. Then some women say they can't work during their first trimester. That is also not true. Unless you work in a department or your workplace is not pregnancy friendly, you're exposed to toxins that could affect your pregnancy, then you probably see obstetrician, and then he would give you an excuse duty, or he would give you a note to your supervisor so that they give you other roles to perform at work.
That's why the booking is very important.
Yes.
And that's why when you go for that meeting, just let them know everything about you and answer every question truthfully.
Yes, because we ask a long list of questions. Sometimes women wonder why we are asking some questions, like where do you work, what do you do, are you a Christian, are you a Muslim? It's sometimes it's weird to them, but every question we have a reason for asking every question that we do. So please cooperate with us and answer every question truthfully.
That is very, very important.
And the last myth,
yes,
that you can't have sex during the first trimester. Unless it's been specified by your obstetrician, sex during the first trimester is safe.
Some people think that it will hit the baby's eye.
No,
so the baby will come with one eye abnormal.
No, it does not work like that.
It doesn't?
No, it doesn't.
Some people think that it will cause miscarriage.
No.
It doesn't?
No. Unless you are already bleeding, you're having a threatened miscarriage, then we would advise pelvic rest. We would tell you to avoid sex. But until you've been told to avoid sex, please don't starve your husbands.
Hey. Doc, that one, I think when they come to the antenatal, it has to be repeated. Because there are so many women who are afraid. On the other hand, I've also heard that in some cultures, when a woman gets into labor, before she goes to the hospital to deliver, she has to have sex with the husband. They believe that, and I know that it has some scientific
it
basis.
does.
Yes. And maybe that is why they think that from the beginning, if you are not careful, especially if somebody has been looking for a child and is now pregnant, she may not take this.
Yes. If for patients with prolonged infertility, we may treat them differently.
Okay.
Yes, we treat them more carefully, because even though sex may not cause a threatened miscarriage or any form of miscarriage, if she has sex and then she starts bleeding, she's going to attribute it to
that.
Yes. So for her, we'll say fine. We'll try to explain to her husband that psychologically she may not be ready. So
okay, ladies and gentlemen, if you have any question, you can send it to me by WhatsApp and we'll get back to you. The number is 059-242-0625. Doc, we are just about coming to the end of our discussion. We have talked about the first trimester or the first 3 months of pregnancy. What would be your final words to not just the women but the husbands as well? What should they know about the first 3 months of pregnancy that they should always keep, and make sure that as soon as they miss their periods, they do that?
Okay, so the first 3 months of the woman's pregnancy are very important. Like I said, this is when the baby's organs are forming. So it's important that you avoid a lot of things like alcohol, cigarette smoking, herbal medications, and medications that were not prescribed by any doctor. So you can't walk into a pharmacy and then just buy an over-the-counter medication and
Yeah.
take it. That's one point. The second is that they report early so that the pregnancy can be localized. If it's an ectopic, we pick it up early and you may be able to avoid surgery. If not, you come in late, the ectopic is ruptured and you need surgery, you may need blood as well. Also, the husbands, our partners, we need a lot of psychological support during the first trimester, because another one symptom is mood swings. All of the pregnancy hormones make you cry one moment, angry another moment, and then you're also craving all sorts
of food.
Yes. So if around 1 a.m. they're sending you to
You go and buy
KFC,
that.
yes, you may have to go. So we need a lot of support. It's important that during the antenatal visits, if you can, the husband should accompany the wife to the clinic, or the partner should accompany the female to the clinic. It helps bond early in pregnancy, and this gives the woman a lot of psychological peace throughout the pregnancy. Yes, so we need their support.
Thank you very much. Dear viewers, dear listeners, we have learned one thing, that the first 3 months is not 12 weeks. It is about 13 weeks. Don't forget that. We have a lot of women who say that I've been pregnant for 10 months and not 9 months. Is the way we count it. We have also learned that in the first trimester, especially the first up to the 6-8 weeks, a lot of things are happening inside you with this baby. The arms are coming, the eyes are coming, the heart is forming. And unfortunately, this is the time that some women take in so many things, especially for those who probably did not want to be pregnant. And if you are not careful and you take these things, you will have a baby that is not well formed, and you don't want to live with a child like this. I would encourage you, if you miss your period, please go to the hospital. Get a proper check. Let them know whether you are pregnant or not, and advise you appropriately and give you the necessary support. All that we're trying to do with the online pregnancy school is to help you to have a healthy baby, and you, the mother, also stay healthy. So many things have been said. The husbands, please give the emotional support. You may be sent to go and buy that particular wachi. When you bring the wachi, the woman may eat just 1 spoon and say that I don't even feel like eating it. So tomorrow when she sends you say, yesterday when I brought it, you didn't eat. So today I'm not going anywhere. Please, it is not her fault. Support her and let her go through the pregnancy. My guest for today has been Dr. Ama Gani. She's an obstetrician gynecologist at the Ridge Hospital, or Greater Accra Regional Hospital. Doc, thank you very much. I'm sure after today you see a lot of the women running to the hospital in the first trimester. That is what we want.
Yes.
Thank you so much for your time.
Thank you for having me.
Distinguished viewers, ladies and gentlemen, thank you for being with us. We'll come your way again. Stay blessed. And please remember the corona. Wash your hands. When you are moving out of your home, going to different places, remember to use your mask. As soon as we get out of here, we are going to wear our mask because we have kept the distance. And make sure your family stays safe and healthy. Bye.
Okay. Thank
Oh,
you.
good. Thank you
so
very
much.
much. I'm sure people will